Nurses dispense comfort, compassion, and caring without even a prescription. Welcome. I am Kayl Semillano.
And I am Radan.
I am Danica Irene TIngson.
I am Nicole Arriana Resuma from DSN3F Group 4B.
Today, we embark on a journey through the intricate landscapes of community health, a vital component of our nursing education and practice. Our study entitled Navigating the Terrain of Community Health, Nursing Students' Experiences and Nurse-Client Interaction During Community Health Nursing Exposure aims to illuminate the multifaceted experience of nursing students as they engage with clients in community settings. As we present our findings, we invite you to reflect on the significance of this interaction in shaping the future of community health nursing and the impact they have on the well-being of the communities we serve. Let us begin our exploration into the heart of the community health and the pivotal role we, as nursing students, play in this dynamic field.
The purpose of this study was to explore the experiences nursing students had when navigating nurse-client interactions during their community health nursing exposure and to determine how these experiences may be managed to better prepare future nurses for community health practices.
Now, let's proceed to the methodology. For the research design, the study adopts a qualitative descriptive approach based on the principles outlined by Creswell 2013, since it recognizes the complexity and depth of human experiences, emphasizing the importance of exploring these experiences from the perspective of those directly involved.
Participants. Purposive sampling technique. With a total number of 10 participants from Level 4 nursing students at the University of St. LaSalle in Bacolod City who have completed their community health nursing exposure.
For the inclusion criteria, participants had to be enrolled for the academic year 2023-2024 and have at least one exposure to community health nursing during the duration of the course.
For our instruments, we have in-depth interview guide that contained the demographic profile of the participants. The central question focused on the nursing students' experiences in nurse-client interaction during community health nursing exposure, and semi-structured questions from interview guide for additional information.
Now, for the results. For Theme 1, Fostering Effective Communication in Community Health Nursing. For the first sub-theme of Establishing Rapport, according to BJ, I established rapport with my client by introducing myself first and getting to know them, especially through active listening. For RT, he said, I established rapport with my client through humor. Culturally, Filipinos are very humorous. For the second sub-theme of meaningful interactions, for LG, she said, a memorable moment was when my client got emotional during our farewell. She said they'll miss me because they got used to my visits. The bond had extended to her children, so it was a tough moment to say goodbye. As a nursing student, it was truly touching and flattering to realize that, even in a short period, I had made a positive impact on their lives.
Theme 2. Unveiled Challenges in Nurse-Client Interaction. Sub-theme 2A, Time Constraints. EG stated, the challenges that I encountered were the time constraints. If someone was to buy at her store, she would stand up and our interview would be interrupted. Sub-theme 2B, Lack of flexibility and adaptability. When we had our community exposure, the weather is always bad, and it is pouring heavy rainfall that leads to cancellation of our exposure.
Theme 3, Nurses' Role in Community Health. Sub-theme 3A, Frontline Caregivers. RT verbalized, I perceive our role in CHN setting of being the bridge of the clients between ignorance of their own health and their knowledge. If student nurses do not interact between health and knowledge, how would they know about the diseases like hypertension? Sub-theme 3B, Educators and Advocates. BJ verbalizes, as future nurses, we play a crucial role as frontline caregivers, educators, and advocates. It is because we provide essential health services such as vaccination, health screenings, and chronic disease management to individuals and families within the community through health teaching. A holistic approach encompasses not only treating illness, but also promoting overall wellness and empowering individuals to take control of their health. For sub-theme 3C, Catalyst for Change, RT verbalize our role in CHN setting is being the bridge of the clients between ignorance of their own health and their knowledge. If you will do your care plans carefully and excellent, you will know that by the end, if your client sticks to the plan, you will definitely see changes. That is only in the span of 3 years you intermittently contact with your client and each time they get better, expand of their knowledge of their health, and eventually they adopt those lifestyle techniques and simple lifestyle that they can adopt in their own lives.
For our theme 4, we have personal growth in community health nursing, and under that we have two sub-themes. Sub-theme 4A, which is building empathy and compassion, and a statement from our participant RT states that, for me, it's no longer a course that you take when you are in nursing school. It's a method. It's a way of how simple students help people. And another statement from our participant BJ, which is, through these interactions, I've gained a deeper understanding of the importance of empathy in delivering effective care. For our sub-theme 4B, communication and interpersonal skills development, our participant BJ stated that my interactions with clients have provided me with first-hand insight into the unique challenges and needs present in the community health nursing. Through these interactions, I've gained a deeper understanding of the importance of being able to adjust to the residents in the community, communication skills, and empathy in delivering effective care.
Now for the conclusion. The research study underscores the critical role of nurse-client interactions in providing holistic care to underserved communities. Through qualitative interviews with fourth-year nursing students in Bacolod City, the study reveals the importance of cultural competence, effective communication, and client-centered approaches in improving health outcomes. The study concludes that nursing students, by embracing cultural awareness, sensitivity, and respect, can build trust and become catalysts for change in community health practices, ultimately enhancing the quality of care provided.
Recommendation. To achieve the best outcomes of this research journey, the team would like to recommend the following. For College of Nursing, they must allocate resources for community health nursing development. For future nursing students, they must prepare mentally, physically, and socially enhanced communication skills. For current nursing students, they must be physically fit, socially adapt, resilient, and practice effective communication. For the community, they must be open to student nurses, identify problems, and adapt to interventions. For future researchers, they must equip future nurses with skills for effective nurse-client interaction in community health setting. For policymakers, they must utilize insights from this study to allocate resources and support for community health nursing programs. Last is for global health organization. They must advocate for international collaboration and knowledge sharing to address common challenges in community health.
As we conclude our presentation, we would like to take a moment to reflect on the journey we have undertaken together. The stories and experiences shared today underscore the importance of community health nursing and the critical role it plays in the healthcare system. We hope that this exploration has provided valuable insights and sparked thoughtful discussion on how we can further support and enhance the education and training of nursing students in community health settings. Thank you for your time, attention, and engagement. Your dedication to advancing community health and supporting the growth of our future nurses is truly inspiring. Together, let's continue to navigate this important terrain and make a lasting impact on the health and well-being of our communities.